Hi, I'm going to talk about targeting antithrombin to treat hemophilia. Hemophilia is an X-linked bleeding disorder resulting from a deficiency of coagulation factor 8 or 9 and is characterized by spontaneous and traumatic bleeding into the muscles, joints, and body cavities.
So, what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit World Hemophilia Day.
Current hemophilia treatment involves frequent intravenous infusions of clotting factors, which is associated with variable hemostatic protection, a high treatment burden, and a risk of the development of inhibitory or antibodies. Fitusiran and investigational RNA interference therapy that targets antithrombin is in development to address this and other limitations.
Clot formation involves, among others, platelets and coagulation factors. The platelets are first to arrive at the scene and begin to loosely cover the injury. Thrombin enhances the activation and aggregation of platelets. On their surfaces, the coagulation factors, also activated by thrombin, accumulate. In tandem with 5A, factor 10A induces the so-called thrombin burst. Finally, thrombin converts fibrinogen into fibrin that then forms fibers, cross-linked through the action of factor 13. This stabilizes the developing clot. In patients suffering from hemophilia, the propagation phase of clotting is disrupted. As a result, they cannot generate thrombin in sufficient amounts to induce normal clotting. The molecule is a B-domain deleted recombinant factor 8. Its special feature? A purposely chosen polyethylene glycol polymer. This polyethylene glycol polymer, or PEG for short, is intended to prolong the circulatory half-life of the recombinant factor 8. In this way, reliable clotting could be restored.
Pros and cons. Fitusiran is an RNA interference therapeutic that targets antithrombin in the liver and interferes with AT translation by binding and degrading messenger RNA. AT therapy silences AT genes expression and preventing AT synthesis. In both preclinical and clinical studies, AT knockdown results in dose-dependent AT lowering when fitusiran is given weekly or monthly subcutaneously. In clinical trials, fitusiran dose escalation has resulted in improved thrombin generation and clinical hemostasis as measured by reduction in annualized bleed rate. Unlike currently licensed drugs, this improvement was not only in patients with hemophilia.
Does hemophilia run in your family? Women with close family members who have hemophilia are very likely to have inherited the hemophilia gene. Until recently, it was widely believed that females don't have symptoms of hemophilia, that they are only carriers of the gene. But that belief is often incorrect. In 2010, the International Society on Thrombosis and Hemostasis found that female carriers had higher mean bleeding scores and lower clotting factor levels than other women their age. The Canadian Hemophilia Society has found that a substantial percentage of female carriers can suffer abnormal bleeding due to injury, surgery, or childbirth, even when their factor levels are in the range of people without hemophilia. They also found that 57% of carriers experienced heavy, prolonged menstrual bleeding. In the United States, the Centers for Disease Control and Prevention found that female carriers often had symptoms of abnormal bleeding, including joint bleeds that limited joint mobility as early as the preteen years. The World Federation of Hemophilia recognizes that female carriers can have bleeding symptoms similar to men with mild hemophilia. They define a symptomatic carrier as a woman whose factor levels are 40 to 60% of normal and who has some of these symptoms. While one of the most common symptoms is heavier and prolonged menstrual bleeding, any of the symptoms shown here could be a sign that you are a symptomatic carrier. If this sounds like you, what should you do? According to the World Federation of Hemophilia, you should talk to your doctor and have your factor levels checked to know if precautions need to be taken. For example, you may need to take steps to reduce your bleeding risk during pregnancy. And you might want to keep a medical alert card or bracelet on you in case of an emergency. If you know a woman who is experiencing symptoms of hemophilia, please share this information with her. To learn more, visit signsofbleeding.com to find useful information and links to other resources about carriers and women with hemophilia. All of us in the hemophilia community must work to increase awareness of women who are symptomatic carriers so they know they're not alone and can have better access to testing and treatment.
In the Ecuadorian Foundation of the Hemophilia, there exist 799 registered patients who suffer from this disease in the country. In the world, the prevalence of the pathology is of 1 for every born alive 10,000. The potential to reduce bleeding in patients with hemophilia with or without inhibitors with a single weekly subcutaneous dose could be life-changing.
My name is Branston. I have hemophilia. I need meds to help my blood clot. Every other morning, Mama gets my meds ready. There's lots of stuff she has to do before the nurse gets here. First, I have to mix my meds. Sometimes this can take half an hour. When they are ready, I get my infusion. I like to help out by pushing the syringe. Sometimes the infusion can last an hour. I need a pump to push the syringe for that. During the infusion, I like to joke and play. This takes my mind off what is happening. When I'm done, we wrap my noodle up so I can play without ripping it out. By then, I'm ready to go and play with my brother and sister. This is my life with hemophilia.